Welcome, everyone. Today, we're not just talking about content, we're talking about purpose. Nursing education is where compassion meets competence, where young minds are shaped into healers, advocates, and leaders. As nurses, we don't just carry out tasks, we carry stories, hold hands during the hardest moments, and sometimes help people die with dignity. Education is where that sacred journey begins. Let's reflect for a moment. What is education? It's not about rote learning, it's about awakening a sense of responsibility towards knowledge, towards people, and towards ourselves. As Jacques Delors said, a truly educated person needs both a broad view and deep focus. And in nursing, that couldn't be more true. We need the big picture and the ability to act in precise, life-saving moments. Nursing education is essential, not just for hospitals, but for communities, for families, for nations. In many rural areas, it's the nurse, not the doctor, who shows up first and stays last. Nurses lead vaccination campaigns, deliver babies, and sometimes are the only health professional a person ever sees. That's why our training must be more than technical. It must be ethical, political, holistic. Our goals go beyond skill building. We aim to shape people who are intelligent, ethical, and socially responsible. We want nurses who can practice safely and competently, can promote health, not just treat disease, can stand up and speak out for their patients, because nursing isn't just a profession, it's a voice for the voiceless. So what does nursing education actually do? First, it teaches, yes, clinical skills, anatomy, pharmacology, but it also teaches us to think, to care, and to question. It develops our hands, our heads, and our hearts. It places us inside real healthcare teams, introduces us to ethical dilemmas, and inspires innovation. Whether you're learning in a lab or practicing in a simulation, the goal is the same: to prepare you for life-saving moments with clarity and calm. The best nursing education respects you as a learner. It understands that no two students are the same. It gives you real-world case studies that make your heart race a little and teach you to stay steady. It builds you up from basic knowledge to complex clinical reasoning and always connects theory to the real-life messiness of practice. Remember, we're not just teaching facts, we're preparing you to respond to suffering with skill and compassion. But let's not romanticize it. Many capable, passionate young people are turned away from nursing school every year. Not because they're unqualified, but because there aren't enough training spaces, clinical sites, or faculty. We face underfunded institutions, a shortage of nurse educators, infrastructure that doesn't match our aspirations. This isn't just an academic problem, it's a public health crisis. Still, we push forward. We fight for better curricula, up-to-date, evidence-based, and contextually relevant. We advocate for stronger oversight from bodies like the Nurses and Midwives Council. We strive to meet global benchmarks while staying rooted in our community's needs. And yes, accreditation helps. But it's not enough without proper resources and the will to enforce standards. Nursing education is where lives begin to change. Your life, your patient's life, your country's future. So I challenge you, don't just study to pass, study to serve, study to lead, study to transform, because the world doesn't just need more nurses. It needs better prepared, deeply compassionate, fiercely ethical nurses. And that journey starts right here in the classroom with you.